Dental implants. Dental implants are basically titanium screws that are placed into the jawbone. They are bio-friendly and will not be rejected by your body. The bone and gums will attach to them as they heal and form a solid base for your new tooth. Most dental implant procedures are completed in a two-step procedure, but some dentists will do it in one. After the surgery, healing will take between 3 to 6 months. Once healed, the piece that holds the crown will be put in place and the crown put on. Other forms of teeth replacement are not secure, such as dentures, and they can cause problems when you eat or talk. Dental implants do not slip or slide. A full or partial denture can be attached to dental implants that will keep it firmly in place, and it is removable. This lets you eat what you want and talk comfortably. They also have the advantage of lasting a lifetime. Crowns on implants look like your natural teeth, letting you smile all you want. They also will never get a cavity or need a root canal. In order to be a good candidate for a dental implant, you will need to have healthy gums and sufficient amount of bone to support it. If this is a problem, surgery can help.